Hi, I'm Dr. John Arlette. We're going to do some ultrasound work while we're doing some filler treatments. Part of it we're going to show ultrasound guided injection. We're going to look at when the product is exiting out of the cannula to give us an idea of where it is, and for you to see what it looks like when it's happening underneath the skin. We'll do it with the color mode on, and we'll do it with the color mode off. So we'll see a distinct difference in terms of different areas where we're going to be able to see filler coming out. And then afterwards, we'll be looking at areas where we've placed filler in the skin, in particular when we're looking at re-draping the mandible and the jawline, so that you can see the areas where we've put product so that we can then fine-tune our results knowing on where we expect to put it and where in fact the product winds up after we had injected it. Color mode. So we can see the tip of our cannula right here. And I'm now going to inject some product. You're going to see, first of all, a reverberation from the cannula down at the bottom. You're going to see product coming up because you see the expanding anechoic space from the filler product. So it helps you understand where it's coming out. Sometimes we'll even see a little bit of flow as the product comes out of the cannula. Increase gain. There we are. So there's our product flowing out. There we go. So I'm going to inject a little bit along the zygomatic arch, just to give a little bit of re-draping. Of course, you can see that I'm aspirating before each injection. And I'll just have you come anterior a little bit. And then we'll look at these areas afterwards to identify the placement of our product so that we'll see is it where we expected it to be? Is the amount that we anticipated to be in the area to give the correction that we're looking for? So we're just going to inject here along the mandible. So we've just gone in through the surface of the skin. We'll run this up to the tip of the chin, and then we'll slowly inject along here. So it'll be helpful for us to watch afterwards about how the product is displayed. Is it a long, thin line, or is it a number of small aliquots or blebs? I would suggest that products that have a higher G prime and greater cohesivity will be more likely to be like little blebs, and that with a lower G prime and lower concentration, lower degree of cross-linking will be more likely to be a thin thread of product in the tissue, as we're trying to just sort of sharpen up her mandible. And so we're just running the product in, and you will be able to see immediately that there is a change. So I'm just going to rotate her so we can see the difference one side to the other. Can you see that? As we've re-draped the jawline, how there's an indentation here, that the jawline is straighter here than it is on this side. It's more indented. We'll work to correct that change on the other side. Okay, so we can start to see product coming up here. And so in this, we're going to put in 0.5 cc's on each side. So we can see how this has come up on this side as well. I'm now going to add a little bit of product to her chin just to bring this down as we look at straightening out the jawline. So we're going to put a little bit underneath the tip of the chin just to bring this down a bit. And we're going to put 0.2 cc's on either side of the symphysis of the chin, of the mandible, in order to bring this down evenly. And then the last little bit that we're going to do is we're going to put some underneath her masseter in this area, and we'll take a look for this afterwards. Just clench for me. So you can put this in from the angle of the jaw. You can go up about 1 centimeter, go down deep to the bone, aspirate, and Katie, we're putting in 0.4 cc's on each side. We've done 6 syringes of filler in a variety of areas, looking to lift and re-drape the skin, produce some foundational changes, and correct some contour. Now now we're going to look at the product that we placed and to see how it appears underneath the skin once we look with the ultrasound. So let's look here on the zygomatic arch where we placed product. And here we can see we have filler. It's right over top of the zygoma frieze. We can see it here as a anechoic aliquots frieze. We're going to move down a little bit onto the upper cheek where we placed product in the skin. And here we can see our product frieze. We can see our product just below the skin above the parotid, which we can see just inferiorly. Frieze. Color mode. We can see our vascularity in this area. We can get an idea how far up the parotid can come and how it can be a little bit discontinuous. But we can see our product is above the SMAS and above the parotid. Let's just go down to the masseter. We can see our parotid posteriorly. We can see our masseter, color mode, and then we can see our product here on the mandible at the base of the masseter as an anechoic collection. We're just going to look along the mandible, color mode. So we can see our product here in the mid space above the mandible, which we see as this white band. We see product which is along the mandible, starting about here at the labiomental fold. We can see our product in place, that it is as aliquots rather than as simple bands or threads. Let's just check the other side. Now here we have, along the mandible, we can see the product as it's displayed. It's not continuous. It is a little bit broken up, but it's very near the mandible. Let's just move along and just check what we put in the masseter. And here's our product posteriorly. Excellent. During our session today, you've seen us use ultrasound to examine filler coming out of the cannula, to see its placement within the tissue as it's coming out. You've seen it with and without the color mode on to show that we are not inside a vessel. You can see it during active treatment, much like you would be doing in your clinic. We then looked at the product after it's been placed to see the volume that's put in, its distribution within the tissue, the amount, the location, so that you can now use your ultrasound after treatment to look at your patients to document that the product is in the location that you wanted it to be in order to accomplish the improvement that you were looking for with your patient. In addition, we've looked at a number of anatomical structures so that we have a good idea of where the parotid is, how it extends all the way from the angle of the jaw up to the zygomatic arch. We've looked at when we've placed product within the deep piriform fossa to examine for the vessels being patent after our treatment. So we've seen a lot of use of ultrasound, not just treating complications, but treating active treatment, treating the results of treatment, which then for you can translate into how you can dictate changes in your therapy, your technique, and your approach to your patients to get the results you're looking for and to help them look their best.